A major change is coming to Medicaid in Michigan, and for some, these new federal requirements will change who qualifies for coverage, how some people maintain that coverage, and could create new barriers for some of the state's most vulnerable residents. 13 on your side's Rick Dorsey spoke with the Kalamazoo physician about what these changes could mean for patients here in West Michigan.
I had a patient that was on Medicaid, got kicked off Medicaid. No way they could possibly afford this medication for thousands of dollars a month.
Because the patient could not afford medication, they ended up with a life-threatening condition, leading to higher medical costs. Tough decisions Michiganders are forced with.
When you're worried about feeding yourself and your family, it's really hard to think rationally about how your costs today will end up saving you money in the long run.
Dr. Isaac Johnson is a resident physician, now practicing in Kalamazoo, criticizes lawmakers for making cuts that do not address the root cause of people using the emergency department instead of preventative care.
The big disconnect seems to be that they don't like how the people are free riding. We're not doing the little things up front, and then it's ending up ballooning. And you could apply it to mental health, you could apply it to cardiovascular health, you could apply it to any kind of health.
Dr. Johnson says the influx of Medicaid patients increase wait times and leads to higher costs for all.
And people will be paying more, waiting longer, and the average patient in the emergency department is going to be much sicker.
Dr. Johnson emphasizes that homeless population would be especially vulnerable.
Unhoused population it's harder and harder for them to get their Medicaid and to get their resources. Then we're going to see more and more of them in the emergency department.